Senator Crapo.
Yeah, I want to make it very clear. I'm not against competitive bidding. I like competition. In fact, what my amendment says is that I like the fact that we should have more competitors, and that my amendment simply says that if the language in the bill or the concept paper does not result, or if the proposal results in fewer competitors, in other words, if we have a less competitive environment, then we should not implement it. That's all it says.
That's what I was saying. Yeah.
Would the senator yield?
Exactly.
Yes.
It doesn't mean.
I would suggest that you're supporting the wrong amendment, that what you ought to consider is not taking the inefficiencies out of Medicare Advantage by competitive bidding, which will take the inefficiencies out. I mean, it gets a cushy 14% more than Medicare fee-for-service. What you're trying to do is to protect the existing seniors on Medicare Advantage, and you'll have an opportunity to do that as I bring forth an amendment that will basically grandfather out most of the seniors on Medicare Advantage. Senator Hatch keeps referring to the Nelson Amendment. That's what you're referring to, Senator, is what's already in the mark. This senator has another one that's coming that's going to grandfather in most of the seniors on Medicare Advantage.
Well, to respond, first of all, I will carefully review your amendment, Senator, when you bring it. But I need to respond, and again, to make it very clear. I'm not opposed at all to competition in the marketplace. In fact, my amendment says that if we restrict competition in the marketplace, we should not implement the bill, the provisions that are restricting it. And when we hear the discussion about the fact that Medicare Advantage is paying 14% more on average than fee-for-service, let's remember, fee-for-service on Medicare does not fully compensate the fees for the true services that are provided. We all have discussed the fact that it's below the true cost of the production or of the value of the medicine that is being provided. And that 14% is not just going to providers. Under the Medicare Advantage system, 75% of that excess is returned in additional benefits to Medicare Advantage beneficiaries, which is why they like the program so much. It provides them that extra buffer, that 75% of the differential in additional benefits. And it's those additional benefits that are making Medicare Advantage such a popular program in our country, and which we should try to salvage rather than to try to eliminate.
Which is why I want a grandfather.
I understand.
Mr. Chairman. I'd like